Save that one for you. Oh, thank you. Yeah, okay. So I'm going to go down the list, and in my mind, not the list that you've got there necessarily, because I don't know what order that is, but I'm going to go ahead and show you the apex. Okay, apex is there, and then the base is all of this, mostly the left atrium. So what I've done now is oriented the heart now, anterior surface and the posterior surface here. Okay, and so we have some grooves to be of interest. Anterior interventricular groove, right there. Sometimes you have to make these, but then the posterior interventricular groove, that's pretty evident right there. Posterior interventricular groove right there. So there's two of the three grooves. The other groove is this one here, which is known as the coronary sulcus or the coronary groove. It is a groove that encircles the heart in its entirety, and it separates the upper atria from the lower ventricles. Okay, best seen on the posterior. So in fact, for lab practical, I can ask the location of my probe. That means I'm in something. In this case, I'm in a groove. Coronary groove or sulcus, whichever name you want. Okay, so we've got those three grooves. Now we can go ahead and identify some vessels here. Okay, so here's the pulmonary trunk right there, and here, what's that?
I was right.
All right, well, good for you. You got one right.
I got one.
All right. And there's the aorta. It's much thicker walled and it's posterior, again, to the pulmonary trunk. So pulmonary trunk, aorta. Now what's left over here, kind of to some degree, is openings for superior vena cava. There it is. It's not much left there.
I was right.
But that's it. And then also we have the IVC.
I was right about all of them. Yay!
Which is right there. I put my probe through there, and then I go all the way in there, maybe, yeah. Okay, there we go, into the right atrium. So that's the IVC. Okay, and that, in fact, this is actually part of the pericardial sac. Because those vessels are wrapped up with the sac, but there's IVC there too. Okay, so we're left with the openings for pulmonary veins. So here, they all kind of coalesce. It's one big opening. Yeah, so that kind of sucks, but that's what you have. Okay, so there you have that. So let's do some chambers now, all right? So there's our right atrium here, not much of it, because the atria are really small, and the auricles are really small in the animal as well. But there's the right atrium. Here's the right ventricle right there, and then we have left ventricle here, and then this is the left atrium right there, even a tiny small auricle there as well. Okay, so not very exciting necessarily with the auricles, but they are there. Let's do the muscles here. I take up the right auricle, I flip it inside out. I've got some pectinate muscles in there. Okay, yeah, pectinate, and that means comb-shaped, if you remember that from the other day. Pectinate muscles there, and then I can go ahead and open up the right ventricle. Let's do the left. Yeah, let me do the left. And you see some crisscross arrangement of muscle tissue. See all that business in there? Kind of crisscross, kind of lattice work arrangement. That's trabeculae carneae. Okay? I'm going to stick with the right atrium for just a minute, or a ventricle rather, and I'm going to go ahead and get this thing out of the way. And we like that, but we don't love it. Okay, yeah. But the papillary muscle is this, not this thing. This is in the way. This has a special name that we don't care about. Okay? That is a papillary muscle with the chordae tendineae, and then this white, flat connective tissue. That is all going to be the tricuspid valve. Okay? So papillary muscle, chordae tendineae, and the valve and tricuspid on the right. So it's always right to try if you kind of remember that one. I just made that up. So.
I like that.
It's not mine, but I just thought I'd throw it out there. All right, so there's a papillary muscle, chordae tendineae, and this is the mitral valve on this side. Okay? So we've got 2 of the 4 valves done. Let's open up the pulmonary trunk. You want to help me here? Kind of unfurl that pulmonary trunk right there, just like that. I'll hook one of the cusps right here. There's one right there. There's one there. And we have one over, yeah, that's what's left of it, I guess. Okay. Notice the semilunar shape to it. Kind of half moon shape. That's the pulmonic valve. All right. Well, that's pulmonic valve. Now, the aortic valve is a little difficult to see, but it's way down in the aorta. Way down in there. Okay. That's the aortic valve. Down in there. So let's see, what else do we have in here? Oh, the layers of the heart. Epicardium, yeah, kind of fatty layer there, and then the myocardium, and the shiny white layer in there is going to be the endocardium. Okay, all right. Ooh, it smells. Okay, so that takes care of that. Let's go ahead and get on that one there. Okay. So we'll go here and we can go ahead and look at nice right auricle, left auricle here. Okay, we'll pull that off, and nice pectinate muscles are there. Okay, we look inside here now. We've got intraatrial septum right in there with the fossa ovalis in there too. Okay, and we can also then kind of recognize another embryological remnant way over here called the ligamentum arteriosum, that white thing right there. All right, ligamentum arteriosum. We can also now see the ascending aorta right there, pulmonary trunk. Okay, right and left pulmonary arteries. All right, and then also superior vena cava right there, and then the IVC right back in here. Okay, there we go. So let's do the coronary circulation. Here's the right coronary artery, number 8 if you want a number there, number 8. And then it provides the right marginal, it goes along the right margin. All right, and it also provides this one back here, the posterior interventricular artery way on the back. Of course, that would be residing in the posterior interventricular groove, as you heard earlier. Okay, so that takes care of the right. Now the left is really small. Even in living beings, it's small too, but it's smaller here because you can't really lift up this left auricle. If you could, you'd see it more, but that little nub right there is the left coronary artery. All right, it provides this one here, which is known as the anterior interventricular artery. Right, and then also the circumflex, which is this one right here. That, of course, as you might suspect, is running in the coronary sulcus. Okay, right there. So there's the 2 branches off the left. And then we're left with now the venous drainage. So on the anterior, we have the middle cardiac. Ooh, we're gonna screw that up. The great cardiac vein on the anterior, and then the middle cardiac vein on the posterior. They both drain into the coronary sinus, which is this. All right. Where does the coronary sinus drain into? Just for
Right atrium.
You got it, right atrium. Okay. So we've got that done. We can also see in this view some pulmonary veins. Okay, nice pulmonary veins right there. And then also we can lift now the lid on this thing. And we can pop it up like that, maybe. There we go. Interventricular septum, right there, big and thick, yeah. Papillary muscle with some broken chordae tendineae, yeah, unfortunately. And then that, of course, is the tricuspid valve. Way up in here is the pulmonic valve. Way up in there. Aortic valve is way up in there. Do I have my point? There it is. Aortic valve way up in there. And then this is then the mitral valve on this side. Nice papillary with some, again, broken chordae tendineae right there as well. Okay, so let's see. I believe that's it. Okay, there you go. We'll be back in 25 minutes. You can do